Your Health Matters. This morning we're joined with one from Greenwood Leflore Hospital, Dr. Douglas Bowden. He's a general surgeon with the Lucas Surgical Group. Good morning, Dr. Bowden.
Good morning. Good to see you.
Hey, March is Colon Cancer Awareness Month, and it's something that you specialize in. We've had some viewers write in and ask some questions. Wondering if it's okay to ask you this morning.
Sure.
Okay, so, last week we had a doctor from Greenwood Leflore Hospital talking to us about colonoscopies, and this week one of our questions came in that said, on a recent colonoscopy, this particular person found a polyp that was too big to be removed and said that they'll need surgery. They're a little bit nervous, and they wanted to ask, what can they expect?
Right. Well, usually, if it's a benign lesion, we can do surgery and just remove that part of the colon that contains the polyp. If it has cancer cells in it on a biopsy, then we would take a bigger section and include the mesentery, which holds the lymph nodes. So normally 2 to 5 days in the hospital after major abdominal surgery like that.
Now, I guess people who think surgery, they kind of get fearful, right?
I understand.
Is it something that should make them nervous? They should be cautious, or you guys do it pretty consistently, so.
Right, but it is a major surgery. So depending on their health status and how many other diseases they might have, high blood pressure, obesity, all of those things increase the risk of the surgery.
And play into those
right.
things. So just things to be aware of. One other question this morning. A viewer wrote in and said that they read that sometimes colon cancer and rectal cancer are treated differently. Right. Can you explain the difference between these two?
Sure. In rectal cancer, many times we add chemotherapy and radiation prior to the surgery. What this does is it can shrink the tumor and downstage it, and so the outcomes are better. And if it's above the peritoneum or above the pelvis, where the colon is, then normally we just remove that part of the colon.
So you wouldn't deal with the chemo or the radiation?
And not until afterwards, usually.
Okay, until afterwards. And let me ask this: once they have surgery, what's the recovery time? Is it pretty consistent? Does it differ with everybody?
Well, sure. Like I said before, 2 to 5 days in the hospital usually. That's without complications. Okay. If they have like other diseases and those sort of things, that comes into play, then it might be a little longer, but that's what you can expect.
And we touched on this last week, but I just wanted to double check with you. Right. When we talk about colon cancer, I think, you can typically think it's one gender or the other, but with colon cancer, it's not, right?
That's right. That's right. We like to recommend that, especially during this month, everybody get a screening colonoscopy if you're 50 years of age or older, if you've never had one. If you're African American, have a history of polyps or a history of colon cancer in the family, then we recommend that you get a screening colonoscopy at 45.
And both male and female?
Yes.
Both male and female. Fantastic. Dr. Bowden, thank you so much
for
being
here
this morning and answering our viewers' questions. All about keeping us healthy and safe. So thanks.
Thank you.
Stay with us. We've got more coming up after our break. We'll be right back after this.
This Health Matters segment is brought to you by Greenwood Leflore Hospital.